I am talking to artist Vanessa Michalak, whose paintings I really enjoy, and she is going to show us some of these paintings. Hi, Vanessa. How are you?
Hi, Heather. I'm good. How are you?
I'm good. First, I want to talk about the fact that you had one plan this winter that was disrupted by the COVID crisis. Do you want to talk about the residency that you were unable to continue?
Sure. I was awarded the Invitational Getamin Artist in Residence. So that's given to an artist who's a Gloucester resident, actually. And yeah, I was extremely grateful for that. The Rocky Neck Art Association and the board members awarded that to me for the month of May. But unfortunately, they did have to cancel all of their residencies due to the COVID-19 crisis. So I am continuing to work, and I do have some paintings here that I can show you that are actually inspired by some of these recent events in healthcare.
Yes, let's get to that. But first, before we do that, I want to ask you about the very famous, around here famous, show that you had in Dogtown, just to give people a preview of the really interesting kinds of things you do. Do you want to talk about?
Sure. Yeah, so that my local claim to fame, I guess, came out of my love for Dogtown, which all Gloucester folks know about. I think it's a number of acres in the center of Gloucester and in between Rockport and Gloucester. But last summer I did a lot of plein air painting there and organized an outdoor art show in October 2019 of all the works that I created on site. So each painting was hung in outside in the landscape alongside of a particular trail, pretty close to the places I actually painted these paintings.
So people have to actually hike into Dogtown to see this show.
Yeah. So it's about a mile hike to get into the actual kind of spot that I was working in, which was kind of like a little meadow that you can reach by the Cherry Street entrance, but rather than kind of going into the Babs and Boulder trails, it's actually at the immediate left after the gates, and it's a little bit more open. A lot of Dogtown has become really overgrown compared to what it used to be 100 years ago, and this has a little bit of the old feel with the open meadows and the blueberry bushes. And I just thought it was a pleasant place to be, so I started working there all summer as kind of an outdoor studio.
And I think of your work as sort of being very painterly and maybe abstracted landscapes, expressionistic landscapes, right?
Mm-hmm.
Can you describe it?
Yeah, I mean, I love to make marks with my brush. So there is this sort of energetic mark making that I enjoy in the process of making a painting. Oftentimes I know where I'm going in the back of my mind, like how it's going to come together, but it can start out very, very abstractly. There isn't a lot of drawing or necessarily planning with lines, but each mark kind of builds the painting.
Your brushwork is really compelling. I love seeing those brushstrokes you use. But I want to connect some dots here. So you had this residency that was canceled because of COVID. And, we're not hearing too many stories of how artists are directly impacted, but you also professionally share this COVID crisis in another way. Do you want to talk about your work?
Oh, sure. So I have a background in nursing and I'm still working as a nurse. Luckily, I am not quite at the front of the lines. I work as a psych nurse in an inpatient unit. And, we are part of a medical facility. So there is, at least at the very beginning of the crisis, there was quite a bit of anxiety about going to work. But it's a little bit different than if I were working on a medical floor. Psych patients are in an inpatient unit, for psychiatric reasons. Usually they're medically stable, but we've had to keep a close eye on our population to make sure they're not developing symptoms of COVID.
So you started to do a body of work connected to the nursing, your work in nursing. Do you want to talk about that? And maybe I see a painting in the background. It's sort of.
Yeah, so being a nurse and, working in the nursing field for quite a long time, I actually got my nursing degree before I got my Master's of Fine Arts. So I've been a nurse since 2004. And throughout my nursing career, when I've been processing, certain events in nursing, or just trying to kind of create sort of a visual representation of what it means to be a nurse, I've taken to painting to do this. So this is not the first time. I produced a small body of work in 2010 in an effort to show the public what nursing is. I mean, now I think people know what nursing is this year, 2020. But I do have a piece behind me that, I'll just step out of the way, is inspired by the protest that was done by the nurses in the union National Nurses United. And it was a protest asking for President Trump to enact the Defense Production Act for the creation of PPE. And so it was a small group of nurses that stood outside the White House, physically distanced, to ask for the dire need for PPE. And I ended up painting mostly from a photograph, like a news photo, but I changed quite a bit of it. It was a cloudy day, you can see in the photo, but I really pushed the color into these dark purples, an ominous sky, just to sort of express my feeling of what is happening politically at the White House. And oddly enough, actually, I found out through a past coworker that one of the nurses in the painting is a friend of hers. So she's actually from Massachusetts. I'm not sure of her name, but yeah, she's the one at the center holding up some of these signs. And actually the signs are really important because they were reading off the names of the deceased healthcare workers that had already passed away, especially in New York City from COVID in the month of, well, maybe March and April. So I can show you a closer view. I'll just move my phone. This can take a peek. Don't know if that's.
Yeah. Oh, that's beautiful. Really beautiful.
Yeah. So it's very close to being finished, but not quite there. I've taken a little break. This is the nurse that is actually a Massachusetts nurse. Should have thought to get her name before I went on air. But yeah, the colors, I had actually started out, just step back, but really sticking, like I said, close to the photograph that I was working from on my computer, but I really felt like it was just too light and like a little bit happy, a little too happy. So I made everything really, really dark. And so the process of making this painting has been a little bit slow. It kind of came together really quickly, like the initial sketch, but then I ended up changing a lot of the painting.
Yeah, there's
I hope to finish it soon. I'm running out of steam and a little bit of inspiration, to be honest, but I've got to work on those signs because they're important. And they will say protect nurses, protect patients, protect public health. So that's eventually what it'll say.
Have you and your institution had any issues finding PPE or securing PPE?
We have not, but it's mostly because, like every nurse probably, we don't use N95s. We're not in the position to need them, but, we have surgical masks that we use for the shift. And, that's kind of the norm right now, but normally you would not use a mask for an 8-hour shift. It would be like a one-time use thing. So, we've gotten used to that, but that's, before this whole crisis, that would have been a really strange thing to do. Right. It would have been considered totally, against infection control. So.
Well, I think it's really interesting to see these masks in an artistic expression because I mean, they are so weighted with symbolism at this point, right?
Mhm.
And I think we will never not see someone wearing a mask as not an emblem of these times.
Sure.
And this painting is just holds that much more drama because of that. And I mean, if these activists weren't wearing masks, it wouldn't quite have the same sort of very specific weight.
Right.
And it will be
Mhm.
interesting to see how these kinds of work age, right? How in 10
Right.
years one looks back at these paintings.
Mhm. Mhm.
And so do you feel as if it, it's been a specific expression for you to be able to, and you probably already said this, but I'd like to hear it again, just sort of unite these worlds.
Oh, sorry.
Oh, drop the phone.
You're propped up on some things.
Just these two worlds that you live in, and how does it feel to unite the two?
You know, sometimes it feels, because nursing has always, for me, it's been an interesting experience to be an artist and a nurse. Because I feel like I do have this way of visually, you know, showing the world, through visual language what, nursing is. So it's sort of a different means to convey that message versus writing or, an interview or, there are other ways to talk about nursing, but visually I don't know too many nurses that are visual artists and nurses. I mean, I think there are nurses that maybe see art as a hobby, but for me, it's very much, it's not a hobby. So I feel like, there is a responsibility in a way to share this sort of, to make something about this time as an artist and a nurse. During the month of April, I really wasn't interested in painting landscapes, which is what I normally paint. It just didn't seem like, I don't want to say the right thing to do, but I just wasn't inspired to do it. This seemed much more important, that I make work about what was going on in the nursing profession, highlight the profession in some way. And I hadn't done that in about 10 years, but it comes in and out of my life and in the visual art. And like I said, it felt like a responsibility to kind of show the world what nurses do. Some of the things I think now with everything going on, like it's not a secret anymore, but for a long time, some of these things that healthcare workers have dealt with in administration and politically, and I'll just briefly bring up question 1 from 2018, which I don't know if you remember.
I remember
that
well.
election. So there are nurses that disagree with me, but it had to do with staffing ratios between, patients and nurses. In order to create a safe environment, a nurse would have been limited to the amount of patients they would have treated with that, I don't know what to call it, law that never came to be. But, the things that we hear about now that have been highlighted because of this crisis, like lack of PPE, lack of staffing, not being heard by administration, there are things that they existed before this. And it's just like so many things in society right now, like our healthcare structure, our education, small businesses, just being highlighted because there, we're at the, I want to say, gosh, I mean, it just, everything is coming to the surface that existed, but in a much more obvious way, I guess.
I
I don't
totally
know if that.
so exposed. No, this crisis is well, someone says this crisis doesn't expose us, it reveals us. So
Right.
I think
Yes.
that's yeah,
That's the word I was looking for.
yeah. No, there are a lot of revelations. Well, Vanessa, thank you so much for talking to us and for sharing this beautiful painting with us. And we look forward to seeing more of your work on Cape Ann. And
All
elsewhere.
right, great. Thank you. Bye.
Bye.